As we continue our series on post-traumatic stress, we attempt to unravel this affliction that some soldiers live with. Now we bring you a different perspective on this burden and what can be done to set those affected on the right path to healing.
PTSD is a recognizable and treatable condition. Its effects can be debilitating and painful, but all experts agree the most important part is getting help as soon as possible.
Something can be done about it. It's not a lifelong thing that you have to suffer with. But the sooner that you get the help, I know it's hard to get the help, but the sooner that you get the help, the more likely that you'll be back on the track that you need to be on.
For some soldiers, this track may be their family or their career, but understanding the reason you feel the way you do is half the battle.
There are soldiers that experienced loss of fellow soldiers. And then there were those who experienced seeing the death of an enemy or just being around it. And of course that has a certain imprint on the mind or heart.
That imprint is not permanent. It can be lessened or removed through several courses of treatment, from medication to therapy, but according to Dr. Buford, it can be as simple as trusting someone.
The most successful course of treatment, I believe, is in establishing a relationship with somebody that you trust. Beyond a medication, beyond what the evidence says, is you have to establish a relationship with someone that you can trust.
Trust doesn't come from a bottle of liquor, and it definitely doesn't come from more violence. It comes from human interaction. Chaplain services is not only confidential, but more spiritual than most therapy practices.
Fear leads to anger, and anger, if it is become a lifestyle, will produce hatred. And then hatred has, from the point of view of all therapies and theologies and philosophies, hatred has a very negative effect on the human mind, psyche, or spirit.
But as a soldier, your hatred may stem from living in fear for a number of months during a deployment. But this fear doesn't have to become who you are. You can change.
While a soldier is in a deployment, they must be battle strong, battle ready, and be able to respond to their training. But when they come back and time changes things, we have to begin to change as well.
If you suffer from PTSD, change is necessary. Combat can cause your stress, but having been in combat can give you the commitment you need to complete your treatment.
But that does take some commitment, just like going through AIT takes commitment, like going through basic training takes commitment, going through the captain's career course, those all take commitment. They take a number of weeks to get acclimated to that training regimen to get back on course.
There are a number of ways, places, and people ready to help you in any way they can. The most important thing to remember is you are never alone.
There's somebody to lead you through all the way. We don't believe in leaving anybody behind in this.
Although post-traumatic stress disorder is hard to overcome, it is possible, and any chance of living without your hatred or stress is worth asking for help. So please, don't live in fear or pain. Ask for the help you need and get back to the life you deserve.